Are we ready?
He will need to be here for the ACA package because he is moving. He's got a couple subs he's going to speak on. So
Okay, just waiting to see if everybody's ready. He's the only one missing.
Is he on this one?
I don't know.
hang on. Jonathan just said script 5 without Wozniak and Scott. He just sent a new script. Jonathan did.
So are we taking Wozniak?
I don't know. He just sent the script.
Okay, we need to know what's going on here.
Okay, so I guess.
No, well, if
Yes.
he's not in the script, we can just,
Is he here?
his back desk is here.
Work on a paper reduction act.
Say,
Right, Madam Chair?
Okay, yeah, we're ready to start. Okay, let's see. Stop it. The Committee on Insurance and Financial Services shall come to order. Mr. Clerk, would you please call the roll to establish a quorum?
Representatives Carter,
Present.
McFall, here. Coleman, here. Stone, here. Breen, Rogers, here. Scott, Young, Fitzgerald, Grant, Harris,
Here.
Markkinen, Bazat, Aragona, Brock,
Present.
Nyer,
Here.
Smith. Madam Chair, you have a quorum.
Thank you. We need a motion to adopt the minutes of June 8th, 2023. Representative Young moves to adopt the minutes as printed. Hearing no objections, the minutes are adopted as printed. First on the agenda is a referral of House Bill 4240 to the Committee on Labor. Let's see. Representative Coleman moves to refer House Bill 4240 to the Committee of Labor on Labor. Mr. Clerk, would you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Yes.
Markkinen, Bazat, Aragona,
Yes.
Brock,
Yay.
Nyer,
Yes.
Smith. You have Madam Chair, you have 15 yeas, 0 nays, 0 pass.
Thank you. House Bill 4240 is referred to the Committee on Labor. Next on our agenda is testimony only on House Bill 4500. Here to explain the bill is Scott Ray from Representative Wozniak's office. Thank you for coming. Please come forward. The floor is yours.
Chair Carter, Vice Chairs McFall and Harris. Thank you for the opportunity to speak with you in the committee today. I'm Scott Ray with the Office of Representative Doug Wozniak, who thanks you for your time and consideration of House Bill 4500. As you know, House Bill 4500 would require an insurance agent to disclose to the customer with whom they are speaking whose interest it is that the agent will be representing. This is a requirement under which real estate agents have practiced for many years and one which Representative Wozniak believes would make sense to apply to insurance agents as well. Under the current insurance code, agent means an individual licensed as an insurance producer, broker, solicitor, or insurance counselor under this act. Agents of the insurer include both captive agents selling insurance for only one company and independent agents selling insurance for multiple companies. Agents of the insured, sometimes referred to as insurance brokers, represent consumers, assisting them to shop for policies from multiple providers. Purchasing insurance coverage can be confusing and even an intimidating process. The length and language of policies is something to which many consumers are not accustomed, and they depend on the agent to assist them with their selection. This legislation is intended to help consumers to clearly understand the nature of the relationship they have with the agent with whom they are working. House Bill 4500 would require agents prior to selling, soliciting, or negotiating an application for insurance to identify themselves in writing as either an agent of the insurer or an agent of the insured, clarifying whose interest it is that the agent will represent. Representative Wozniak believes House Bill 4500 is simple, common sense legislation that will provide insurance consumers important information at the beginning of the process of obtaining the coverage they need with the help of a licensed professional whose role they understand. Thank you.
Thank you, Mr. Ray, for your testimony. Do any members have questions? Representative Fitzgerald.
Thank you so much, Madam Chair. With regard to disclosing as an agent, are you required to disclose all the insurance companies that you are appointed with, recognizing that an independent agent may have 10, 20, 30 plus appointments that they are companies that they are appointed with? Would you have to disclose all of those? I don't see that clarified in the language here.
The language indicates that before beginning the process of working with a consumer relative to their insurance needs, you would disclose whether or not you're representing the companies or insurance producer or working on behalf of the client or consumer.
Follow up, if I may. So with that in mind, I'm curious to know how this might affect the relationship that one has between an agent and a consumer, recognizing that not all products are bought by a single agent or through a single agent. You may have a life specialist, you may have a business specialist, should you be a small business owner or a business owner of any type. You might have life policies elsewhere. I'm just curious to know how this would impact that, and does that provide actual clarity to the insured?
Certainly. The intent is that each time that you would speak with someone seeking to assist you in purchasing insurance, much like with a realtor, when you go to purchase your home, the first thing they have to do before they collect your personal identifying information and begin working with you to select a home or a lake house or a piece of property adjacent to your home, etc., that individual must tell you whether or not they're representing the seller or representing you in that transaction. So in this case, with insurance, you simply, depending on the type of insurance you're seeking to purchase, if the individual is a representative of the company selling a policy for the company and thus has a fiduciary responsibility to that company, they must indicate to you whether in writing whether or not they're representing the company or whether or not they're representing you, the consumer.
I'll hold any additional follow-ups until others have a chance.
Thank you, Representative Fitzgerald. And we do have a full agenda today, so I would ask if you could limit questions, to one question if possible because of how big the agenda is. Okay, next. We have cards to read in on 4500 from Alex Hausman of the Big I, not wishing to speak and opposes the bill. We have Marcia Hume from Life Insurance Association of Michigan, not wishing to speak and opposing the bill. Next on our agenda is testimony only on House Bill 4595. Here to explain the bill is the bill sponsor, Representative Martis and Joseph Sullivan from the Department of Insurance and Financial Services. Thank you both for coming. Please come forward. The floor is yours.
Thank you, Madam Chair. Thank you to the committee members, staff, my staff, Ashley and Peyton, and Joe from DIFS for being here. I'm here to testify on a bill that's relatively simple. The bill would repeal a requirement for DIFS to provide an annual report on life and health insurance producer examinations because, as my mother would say, the juice ain't worth the squeeze. A lot of times the work that we do here in Lansing, we want to be large and exciting. I would love to come to you with a speech on par with Kennedy's inaugural or President Obama's speech at the DNC convention, but most of the time the work that we do here in Lansing is not a question of more government or less government, but making sure our government acts in a way that is efficient and effective. This report that has been produced annually for a number of years is not efficient, is not a good use of taxpayer dollars, not a good use of the resources of the folks who make DIFS work. DIFS compiles many important statutory required reports, but there's currently no evidence that this one really does much besides burden the folks that work at DIFS to have to produce this information that relatively few people read. This report on this report is viewed on average only 9 times on the website. This 9 times that this report is viewed is mostly by folks that already work at DIFS. They're double checking their work, making sure what's posted online, crossing those T's and dotting those I's, or it may be folks that just so happen to stumble upon this page. So the law that we're talking about was originally put into place in 2008, was a part of a larger push to promote uniformity among states producer licensing acts on recommendations from the National Association of Insurance Commissioners. However, this specific report we're talking about today was not a part of that recommendation. Ultimately, our office took an interest in this because, again, a lot of the work we do here in Lansing may not be exciting. It may not be the thing that makes the headlines, but we want to make sure that our taxpayer dollars are being used effectively and efficiently, and the folks at DIFS are able to focus on the important work, the integral work that they are tasked with. With that, I can throw it over to Joseph Sullivan from DIFS if he has anything else to add.
Thank you, Madam Chair. Appreciate the time, and I'm glad to see a room full of people here excited to hear about this bill. So this bill really stems from last fall. We tasked various areas in the department to look at some efficiencies, and this was a recommendation that stemmed from that effort. The report, which was 18 pages last year, requires work to compile, and there's no evidence the information contained in the report is utilized or provides any benefit. Essentially, the report is statistics on licensing exams, so things like mean scores, standard deviation of scores, correlation rate on questions, so really interesting stuff there. Repealing this requirement would better optimize DIF's resources for our insurance licensing area, which processes licenses for applicants. If you recall, during our overview for the committee, we spoke about the increased activity in that area. We already went over the history of why this was written into law, so I won't cover that, but essentially just this proposal is simple. We believe it would allow DIFs to operate more efficiently, and there's little to no downside with striking this reporting requirement. So thank you, and I'm happy to answer questions if you have any.
Thank you both for your testimony. We do have a question. Representative Rogers.
Thank you, Chair. My question is, so the job of the legislative branch is for oversight. And so if this were to move forward and these reports were not to be generated, what would be the mechanism if DIFS discovers that issues arise? So I guess that's kind of a question for DIFS.
So as far as if an issue were to arise, well, we don't get asked for this information right now. So as the representative here had said, the last time we checked, our website only had 9-page views. It is an incredibly complicated statistical report that we actually have to contract out and have somebody develop for us. So I don't know that we would have that information that's in this report, but essentially it's just statistics on those that are taking our producer licensing exams. I'm not sure there's much public benefit to this. And as far as checks and balances of the executive and the legislative branch, that's why we're here before you today to say, hey, the statute requires this reporting requirement for us. We don't think it's beneficial, and we're putting it before you to make the determination as to whether this should be repealed or not repealed.
Thank you.
Representative Young.
I'm just curious, has this report ever been useful? I mean, it's on the books. So right now there are 9, but was there a time there were 1,000? Was there a time there were 500? Or it's pretty much been like this?
You know, that's a great question. I don't think that we've gone back and looked at page views for multiple years. Just this last previous year's report, I don't think it was ever really anything that was useful. It was just something that was added to the 2008 package as an afterthought. That they put in there. It was not an NAIC accreditation requirement. It wasn't part of the standardization that they were looking to do with the licensing areas with various state insurance departments. So ultimately, we've had the time to look at that and have come to the conclusion that maybe this is something we could eliminate and free up some staff time to process licenses potentially quicker.
Free up but not let go.
No, not let go staff. Yeah. Good question.
Thank you. Are there any other questions? Hearing none, thank you so much for your testimony.
Thank you so much.
Thank you. And I assume the large crowd we have here today was about this one-sentence bill, so, you know.
Only in the insurance committee, okay,
Yes.
gotcha. Next on our agenda on House Bill 4304 and 4303. Here to explain the bill, this right here.
47.
Excuse, I'm so sorry. 4703 and 4704. Here to explain the bill is sponsor Aragona, let's see, and Chuck May of NAVA. Thank you both for coming here. You belong here. And the floor, please take your seat. The floor is yours.
Thank you, Madam Chairwoman, members of the committee. I'll try and keep this pretty brief because obviously we've had a long day. With me today is Chuck May from the National Association of Independent Financial Advisors. Before you are two bills. The first is 4703. Financial advisors in the state of Michigan, like many other professions such as realtors, insurance agents like Rep. Carter, myself, and Rep. Fitzgerald, we are required to have certain continuing education credits every couple of years. 4703 states that in order to if you are part of an association such as the National Association of Independent Financial Advisors, you can use that membership, as long as you're on a board, to qualify for some of those CE credits to satisfy that requirement. There is language in the bill that says that, Representative Carter and myself can't just decide that we now have our own association and that qualifies. That's not copacetic. You actually have to go to DIFS. DIFS needs to approve, and once they do, it will satisfy those CE credits. So if you don't mind, Madam Chairwoman, I'll just take it one at a time. I'll turn it over to Chuck, and then if we got any questions on the first one, we'll take them at that point.
Thank you, Madam Chair. I'm going to be very quick because I know it's been a long day for you. Michigan would be the 14th state that has adopted this law into practice. Recently, 2 years ago, Illinois General Assembly passed their bill that allowed allowed 4 credits, up to 4 credits to carry over. We have a draft bill in place, and we would look for your support.
Thank you. That is very brief. Rep. Fitzgerald, do you have a question?
Yes, I do. So are there any other professions that are currently allowing for this type of continuing ed
Gained in this manner. I'll start there.
Yes. We're representing NAFA here today, and we've really only concentrated on NAFA.
Okay.
So at this point in time, we're not aware of any. I'm sure they're out there. We're not aware of them.
Is there a widespread issue with people gaining enough continuing education credits to remain compliant or to have their license renewed at this point? So are we trying to provide more opportunity for that continuing education credit? Should it be too onerous, or is this, in the belief that what is being attained, in this function is adequate for a continuing education requirement?
Yeah, and if I may take that one, it's a good question. Just to your first question, it's organizations like these that make the profession better. It's organizations such as NAFA that helps us have quality financial advisors throughout the state that help people of all wealth ranges build their wealth. To your second question, a lot of the people who take the time to become a board member, to become a committee member in these types of organizations spend hours making sure that their members have the right information, that they're getting the proper education. So that's why we think that a portion of the CE credits that are mandated should be, that should satisfy these CE credits. Normally, if you're not part of the organization, for instance, I'm sure you're aware, insurance agents, it's usually just an online class that you take. You listen through some lectures, maybe you answer some questions. This is far more encompassing to be a board member. However, it doesn't count towards these CE credits. So the point of this bill is just simply to allow it. Again, if you think there's other organizations or other professions that might also benefit, I'd be more than willing to take a look with you. Thank you.
Next, we have Representative Rogers.
Thank you. Representative Fitzgerald asked a couple of my questions. I absolutely support continuing education. I myself am a physical therapist. I'm a member of our, for example, APTA Michigan, and I am not familiar with any other profession that's allowed to do this. So I'd just be curious if you could follow up with us if you find any other professions, because I am not familiar of any other professions that is allowed to count simple membership. So getting to my question, how do you determine active membership versus passive membership, and how would enforcement go? How would an agency go about enforcement in determining if there was active versus passive membership? Thank you.
Well, active membership means on a board, not just simple membership. And we're in the process of drafting language with DIFs on this. We're working with them hand in hand. So when this came up, that's really the only thing that has been in the way of this bill. So you're right on.
Thank you. Representative Bruck.
Thank you, Chair. One question, how many CEUs are required currently?
24 every 2 years?
Every 2 years. Yeah.
Okay, and would this be for a credit of 4 each year, or would that be for that 2-year period?
For that 2-year period.
Yeah, for the total.
Okay, thank you.
Representative Stone.
Thank you, Madam Chair. Just a follow-up to Rep. Rogers' questions. Is there discussion around who's responsible for logging these hours, and how many hours of participation would be necessary to fulfill this?
That's a real good one. I do not have the exact hours. We can swing back around with you for that. There is discussion.
Yeah. So again, it's not simple membership. This isn't, I become part of NAFA, therefore I get 2 less CE hours. That's not what it is all. There's a portion of people that will qualify for this, and it's those that are in leadership in these type of organizations. It would be qualifiers sent to DIFs to say, it's part of NAFA. Is NAFA a qualified organization? Yes. Okay. What do they participate in? They are part of the state board. Okay. That clearly takes plenty of hours. That qualifies. Just simply saying, you're part of NAFA. That's qualifying organization. Are you in any type of leadership? No. Okay, that doesn't qualify. You then need to continue and get those continuing education hours. Does that make sense?
Yeah, can you follow up with what that looks like as it progresses? My concern is there are people who take a title to be on a board and maybe not follow through with responsibilities.
Sure.
So just making sure everybody's accountable.
Okay, are there any other questions? Hearing none, thank you so very much for your testimony. We have some cards to read in for you as well. Ryan Burtko, National Association of Benefits and Insurance Professionals, not wishing to speak but supports the bill. That's 4703. We have, no, he's speaking.
Yeah, he's speaking.
Okay. And we also have Alex Hausman of the Big I, Michigan, not wishing to speak and also supports the bill. Thank you, thank you, thank you. Okay, this is interesting. Want to give a second? Would you like to say something?
Can I finish up on the last bill?
Oh, I thought we did.
Oh,
Okay.
no, so that was 4703, and
Okay.
members, just the final bill is just a gift limit increase for life insurance providers. It's actually creating parity with other insurance lines. So this would increase it from a $5 limit, which was set back in the 80s, up to $50, which obviously that seems more normal for today's prices. So.
Thank you, Rep. Aragona. I think I was just multitasking here and heard the first bill. So are there any questions on the second bill? This is 4704. Now hearing none, thank you, Representative Aragona. We have Alex Hausman, who supports the bill from the Big I, not wishing to speak. Here we go. Thank you. I think this is the part that got me a little nervous. Next on the agenda is testimony only of House Bill 4732, introduced by Representative Harris, and House Bill 4733, which I introduced. The committee will now go at ease at the call of the chair. That's you.
This one.
Right there.
Okay. Do I hit the hammer? Oh, at the end.
Yeah, but
Okay.
no. He said, yeah, he'll say the committee will come back.
Okay.
Yep.
The Committee on Insurance and Financial Services will come to order. Madam Chair and Representative Harris and Carla Bell Johnson from Aflac. Is she also speaking? Okay. All right. Please begin your testimony.
Thank you, Mr. Vice Chair. Thank you, Madam Chair, for sitting here with me. So I can promise you this will probably be the least amount you hear me testify this year. I can't speak for the chairwoman. So House Bill 4732 and 4733, they're very closely related. This has to do with supplemental insurance. So, for example, Aflac, as we're going to hear from here shortly. So what this does is there's a definition in the Michigan Code that defines what the supplemental insurance is. But instead of us having to, as the federal code changes, come back and reopen the section of law to update definitions and whatnot, all this does is it simply points to the federal code, and that way it stays updated all the time without us having to recreate this every time. Madam Chair?
Thank you very much. This bill package is simple and technical in nature. It states that a health insurance policy does not include a policy that provides expected benefits as outlined in federal law. Supplemental insurance is different from major medical insurance. These bills will align with the Michigan Insurance Code to federal law on how these supplemental products are treated. Together, House Bill 4732 and 4733 will amend the definition of health insurance policy to mean expenses incurred in a hospital, medical, surgical policy, certificate, or contract. It specifies that it does not include a policy that provides coverage only for expected benefits, therefore removing the ambiguity between state and federal law. I would now like to turn things back over to Rep. Harris for any additional comments.
Thank you, Madam Chair. We're open to any questions, or if you'd like to wait until after Aflac testifies, we'd be happy to answer any questions you might have.
That would be great.
All right.
Does anyone have any questions?
Okay. She's going to testify.
All right. Thanks, sir.
Oh, okay. What is her? Carla Bell Johnson from Aflac. If you'd like to testify.
Yes, sir. Thank
Oh,
you.
I didn't know she was
Good
online.
evening, Chairwoman Carter and committee members. Thank you so much for your time today. I will be brief as well, seeming as though you have had a very long day. Again, my name is Carla Bell. I am a regional director with Aflac. Aflac, as some of you may know, is a supplemental insurance company. We supplement major medical. Our policies include hospital, accident, cancer, disability, and specified disease. Our products are actually designed to help with unplanned expenses that occur after an unexpected event like a cancer diagnosis or an accident of a broken leg that sometimes will wound you a trip to the hospital. What makes our policies, however, very unique is the fact that we pay benefits, cash benefits directly to the policyholders. And our policyholders can use these cash benefits to cover costs based on their own individual needs. So it really runs the gamut. It could be used to pay for meals, transportation, childcare, you name it. It really runs the gamut of how our benefits can help a policyholder. Also, the federal government recognized the uniqueness from supplemental policies and major medical policies. And as a result, way back in 1996, they came up with what is defined as HIPAA accepted benefits. These benefits help to distinguish and classify the differences between major medical and supplemental insurance. So the two bills, as Representative Carter and Vice Chairman Harris have eloquently described to you, these two bills, House Bill 4732 and House Bill 4733, really does two things. One, it helps to distinguish the differences between the two, between major medical and supplemental, by providing a technical change to the Michigan Code section that will strengthen it by amending two sections in that code section, Section 608 and Section 3701. And secondly, it removes any ambiguity in the code section as it relates to supplemental and major medical, and by including the HIPAA accepted benefits federal language. I want to thank Chairwoman Carter and Vice Chairman Harris for their leadership on this topic, and I stand ready to answer any questions that this body may have.
Thank you for your testimony. Do any of the members have questions? Nope. Not seeing any questions. Are there any cards to read in? Thank you for your testimony. Where am I at? Okay. Oh, okay. The committee will go at ease.
We'll now read in cards. We have Joseph Sullivan from the Department of Insurance and Financial Services, not wishing to speak, and neutral. We have Carla Bell from Aflac. Is not. Oh, she did speak. Okay, so we don't have to read that one. Okay, so now we're back to. Here we are. Okay, are we ready for it? Next on our agenda is House Bill 4707. Here to explain the bill is the bill sponsor, Representative Brayback. David Lloyd, Chief Policy Officer of Kennedy Forum, Rachel Murray, founder of the Advocates for Mental Health in Michigan, and Janine Tegarden, who is the parent story, who has a story about this legislation. Thank you all for coming. Please come forward. The floor is yours. Representative Brayback.
Thank you, Madam Chair. Vice Chairs McFall and Harris, thank you so much, and members of the committee, thanks so much for allowing us to testify today on House Bill 4707. As a licensed clinical psychologist, I've had the privilege of helping many individuals with significant mental health challenges. I've also seen the profound impact on people when insurance denies services or prematurely cuts off coverage. That's why I'm proud to sponsor House Bill 4707, legislation that will increase access to effective services. In the days and weeks since I've introduced the bill, many of our colleagues have shared stories about the growing mental health and substance use crisis in our state. From our local jails being filled with people struggling with mental health and addictions to emergency responders dealing with harrowing instances of overdoses. It's startling but not surprising that an average of 11 Michiganders a day die by suicide or an opioid overdose, and that was just in 2021. There are untold numbers of personal stories, some of which you'll hear today, stories of families who have faced financial devastation and premature discharges from treatment after being denied coverage for desperately needed mental health care. As legislators, we can see the toll that it takes when people don't get the treatment that they need. We can also see the cost shift onto our public systems like child welfare, education, justice, as well as the cost to our state in increased homelessness, school failure, and strains on law enforcement, emergency departments, and hospital systems. In 2008, the federal parity law set an expectation that insurance coverage of mental health and substance use conditions would mirror that of other medical conditions. Unfortunately, ambiguities in federal and state laws have led to uncertainty and too often individuals and families being left without coverage or recourse for clinically appropriate treatment. House Bill 4707, though, provides a solution, and it creates clarity in state statute that will provide a level playing field for health plans and peace of mind for Michiganders. Here's a couple of things that it does. It requires coverage for decisions to be consistent with generally accepted practices and standards of care, not necessarily arbitrary criteria which could be used to deny appropriate services and limit care. It requires parities in levels of care plans to cover both intermediate services, such as partial hospitalizations or residential care for substance use disorders, not just inpatient care and outpatient services. And if appropriate, and in-network services are not available, it requires out-of-network services to be covered at no additional cost to the insured. It also requires plans to cover treatments of underlying conditions, not just short-term symptom reduction that results in cycles of relapse and unnecessary high costs to emergency department visits and hospitalizations. California, Oregon, and Illinois have already adopted similar legislation, and we have the opportunity to show some leadership here in Michigan and do the same. We would never stand for an insurance company to discharge a person from a hospital after their symptoms of a stroke subsided, but without providing treatment to address the underlying condition, like high blood pressure. And we wouldn't tolerate people being denied coverage or covered just for a fraction of the cost if the only timely available dialysis treatment was out of network. Yet in a few minutes, you'll hear how families have been impacted by these issues, and issues that this bill is designed to fix. In the face of growing mental health and addiction challenges in every corner of our state, we can reduce the downstream costs of failure to treat and offer real hope by ensuring people with health insurance are covered fairly. I look forward to seeing this bill get out of committee and welcome the opportunities to engage in dialogue with our payers, with patients, and with members. Thank you, Madam Speaker, or Madam Chair. You got elevated.
And now David.
Thank you, Chair Carter, Vice Chairs McCall and Harris, and members of the committee for the opportunity to testify. My name is David Lloyd, Chief Policy Officer of the Kennedy Forum, a nonpartisan nonprofit that works to transform mental health and addiction treatment in our country. Our founder, Patrick Kennedy, was lead co-author of the bipartisan Mental Health Parity and Addiction Equity Act, which was signed by President George W. Bush and sets a basic floor underneath mental health and addiction coverage across the country. The Kennedy Forum is proud to support House Bill 4707, which is critical to addressing the ongoing mental health and addiction crisis. I have already lost 4 friends in my hometown of Grosse Pointe to deaths of despair. Treatment saves lives, yet families in Michigan find that their health plan is often not there when they need it, failing to cover key parts of the care continuum or not covering recommended treatment as, quote, not medically necessary, even if the treatment is fully consistent with generally accepted standards of care. Representative Brayback did such a good job covering the bill's provisions that I won't re-go into those bill's provisions, but suffice it to say that the bill puts in place a common set of standards that applies to all health plans and creates a common language between clinicians and health plans. This spring, the state of Michigan joined a federal amicus brief with 14 other states on the importance of health plans following generally accepted standards of care. Just a couple examples of what these standards of care are. They include treating underlying conditions rather than mere alleviation of current symptoms, and treating mental health and addiction for an appropriate duration based on individual patient needs rather than arbitrary time limits. More than a dozen other states have already put in place requirements tying medical necessity determinations to criteria and guidelines from nonprofit clinical specialty associations such as the American Society of Addiction Medicine. Importantly, under HB 4707, health plans will be allowed, indeed they would be expected, to refuse to pay for services that were inconsistent with generally accepted standards of care and nonprofit guidelines. HB 4707 will help families in Michigan access the treatment they need during an unprecedented mental health and addiction crisis, decreasing the profound effects on these illnesses have on families and communities, and preventing cost shifts to state and local governments. For these reasons, we proudly support HB 4707. I'm happy to answer any questions you may have. Thank you.
We will wait until each testimony is heard, and then we'll open up for questions. Rachel.
Thank you, Chair, for having us and committee for hearing this bill. My name is Rachel Kasheri Murray, and I am a resident of Eaton County. The hardest decision I ever had to make in my life was to send my child out of state to receive the mental health care that he needed. And the second hardest decision I had to make was to go deep into personal debt to do that. In the summer of 2021, just 2 years ago, I tried to do everything right. I called my insurance company 3 times to get a list of in-network providers. They were never able to produce one. I repeatedly asked to be connected to a behavioral health specialist as covered under our plan, and they never did it. When my son entered treatment, we made sure that the provider requested pre-authorization as specified by our plan. The insurance company sometimes claims they never received it, but they somehow managed to send us a denial letter signed by a geriatric psychiatrist anyway, not a pediatric psychiatrist. Over the next several months after I received the denial, I spent hours on the phone repeatedly asking for a copy of the MCG guidelines, which were the criteria that they used to deny my son and say that he didn't meet medical necessity. This is something that they are required to do by law, but after several months of calling and asking, they didn't provide it until I got an attorney involved. I filed an appeal with a ton of supporting documentation based off of this information that I had, using that information, but the same geriatric psychiatrist denied our appeal again, once again saying that the treatment wasn't medically necessary. It didn't matter that 5 medical specialists who had worked directly with our son had documentation showing that it was in fact medically necessary. But over and over again, the representatives gave me wrong advice about how to file appeals, what my rights were, whether the claim was even received or whether it was being processed. Meanwhile, I was refinancing my house, emptying college and retirement savings, and taking out loans against our life insurance policies to get my child the treatment that he needed to keep him alive. My family is not unique. After having this experience, I joined with 2 other parents who were having similar problems with the mental health system, and we established an advocacy group called the Advocates for Mental Health of My Youth. In the past 15 months, we have connected with well over 600 other families across the state of Michigan by word of mouth alone. That means that there are surely thousands of other families like us in the state who are unable to access the mental health care that their children need. And we're all living in crisis because of it. Families like one in Ottawa County, whose child was approved for treatment in a residential placement facility due to the severity of her case, the insurance company started pushing for discharge after 14 days. The doctors said it would be criminal to discharge the child in her current state, but somehow the insurance company pressured the facility to discharge her within a few days. Within 2 weeks, they were back in the ER with their suicidal child. And a family in Oakland County who says it was easier to get in-home nursing care and a ventilator provided to her medically fragile child than it has been trying to get mental health coverage for her autistic child. If that's not parity, I don't know what is. And a mom from Wayne County whose plan didn't cover an appropriate treatment facility as in-network. When the family went out of network and submitted their claim for reimbursement, it took months to receive the denial letter. The child was discharged prematurely, and the family incurred extraordinary debt. And a family in Marquette City, whose insurance company only paid for 14 days of necessary treatment before they pulled coverage. The insurance company claimed that the child was stable, even though she was suicidal and on a safety plan at the treatment facility. The family's appeal was denied. And the Shiawassee family who got a $20,000 bill because their insurance company only covered half of their child's hospitalization and cut them short on outpatient therapy and psychiatry coverage after his discharge. I could go on. And honestly, we have several families here who drove across the state because this is so important to them. They came from Ottawa County, Oakland County, Wayne County, Jackson County. We are all watching this bill. It's very important. I think it's important to call out where families in this situation often end up. Our families often end up with CPS involvement, and we are often encouraged to relinquish our children to the foster care system so that they can access treatment on the taxpayer's dime that isn't available to children who have families and insurance. Children also often end up in juvenile detention because their behaviors are so out of control that they become destructive and dangerous. I've heard that our criminal justice system costs 3 times more than mental health treatment. Insurance companies are offloading that cost onto taxpayers. The stories I shared from our families are appalling, and we all know that nobody would allow this to happen if our children had cancer. Our kids with mental illness deserve the same hope at a decent life that a cancer patient does. My son is back home now, and he's doing much better. He's improving every day. And that's wonderful, but my family shouldn't have had to go deep into debt to get here. So I hope you will please support House Bill 4707. Thank you.
Thank you. And Janine.
Hello, my name is Janine Teagarden. Thank you, Chair Carter, Vice Chairs, and members of the committee for hearing HB 4707 today. Our son is in treatment in Idaho, and we are $250,000 in debt. Let me tell you how we got there. My husband Jay and I have 2 sons adopted through foster care here in Michigan. Both boys are full of energy, curiosity, and adventure. Both have special needs. Our 13-year-old, however, has more complex mental health care needs at this time. His neuropsych evaluations report a diagnosis of complex post-traumatic stress disorder, along with several others. You may be more familiar with PTSD in the context of a war veteran. This gives you an idea what these babies survived. After the pandemic, we found ourselves with our son in a cycle of hospitalizations, medication trials, and evaluations. When things got serious with our son, we had Blue Cross Anthem through my husband's employer. We thought we were in good hands because they were the first to reach out during a 10-day ER stay and tell us our son needed residential treatment. However, they were not able to produce a list of in-network providers that were appropriate for our son. The hospital sent out applications to various inpatient hospitals anyway in Michigan and out of state, but he was denied a bed. Eventually, we learned there are no beds because he's so young. And our son did not need a lockdown behavioral hospital setting. What we needed does not exist in Michigan. After that first hospital stay, we began working with community mental health in our home, and our son's behaviors escalated. I was not able to handle him, so my husband left his job to care for our son and open his own business. At that point, my employer started providing Blue Cross of Michigan, and we continued our search for a higher level of care for our son. We were not just looking for a bed. We needed the right bed, appropriate care for our son, a vetted, trauma-informed, relational-based therapeutic center for his age, with experts for his needs, with an appropriate milieu. That's the mix of other patients in the facility, with proof of successful outcomes. We found what our son needs out of state. Do we want him so far away? Absolutely not. Do we want him alive and well? Yes. Insurance claims that I submitted through Blue Cross of Michigan's portal disappeared, despite me receiving confirmation of submission. So I started faxing claims so I would have a printed confirmation receipt. I would call Blue Cross to follow up, and they would claim that they had not received them or they were not entered yet. and they needed more time over and over again. We filed monthly and then weekly claims with Blue Cross for 18 months. They simply were not processing claims. No denials, no approvals, nothing, no decisions. So we could not appeal. We were just stuck. At this point, we hired an attorney. She has taken over my role of sitting on hold with Blue Cross, collecting evidence, calling repeatedly, and pestering them to get progress. After 9 months of calls, faxes, and emails to our insurance, we were finally informed by Blue Cross that 42 weeks of claims were denied. While one random week shows it is covered, no one at Blue Cross can tell us why that week is different. We found out about that approval for that 1 week exactly 2 months ago today, and we still have not received the reimbursement for that week. We also discovered that our original appeals have been improperly placed by Blue Cross into a complaint pile rather than processing the appeal. We are still awaiting corrected processing on claims from 2021 and the decision for our expedited appeal request. Meanwhile, I was laid off from my job. I immediately signed up for COBRA to cover us until I became eligible for insurance at my new job. The claims we submitted during those 3 months have all been denied on the basis that Blue Cross says I was uninsured. My new insurance through my new employer is Priority Health and became effective June 1st. We submitted prior authorization for my son's treatment immediately. We received a call on June 9th denying coverage because they say the facility treating our son does not meet their definition of residential care. There is not a 24-hour on-site nurse. However, their plan goes on to state that patients admitted to residential are usually voluntary and unlikely to need extensive nursing. Their own plan contradicts itself.
I'm sorry, we have a lot of speakers, and I know that your testimony is extremely important, but we want to have the opportunity for everyone to have a chance to speak. Do you have much more?
I'm almost done. I just
Okay,
did
but
big
then
print, so
please,
I can't
please,
lose my
please
place.
finish.
I'm sorry.
No
Thank
worries.
you. So either way, the facility treating our son does have 24-hour on-call nursing, in addition to psychiatric care and other extensive services for mental health, and they are nationally accredited by the Joint Commission, the same as hospitals. At this point, we have paid over $300,000 in mental health care costs, 100% out of pocket. And we don't have $300,000 in our pocket. We had to drain our savings, retirement, sell our car, max out credit, borrow from family, and fundraise. Even still, somehow Blue Cross says we have not met our deductibles or out-of-pocket maximums. Our son and other children like him are worthy of every penny, and there's no question we're doing what is right to save them. It is not right that families are going bankrupt due to the barriers of insurance. We must provide our children with the best chance at a quality life. This is life and death. This is our children's mental health, their safety, their life. This is everything. When children are denied appropriate care, they become adults dependent on systems which they could have otherwise contributed. In the long run, providing care to children increases their chance at being successful adults. It also means that families can pour their resources into the economy for years to come rather than draining their savings for care. Please support Bill 4707. Thank you.
Thank you very much. Appreciate it. I can feel it. My son had PTSD, and he's no longer with me. Okay. We have questions for your team. Representative Aragona.
Yeah, thank you, Madam Chair. And thank you, everyone, for being here. Representative Brayback, thank you. So I'm trying to wrap my arms around this bill. The bill is mandating certain coverages for insurance providers, correct, for mental health. It's above and beyond additional.
So in 2008, I can remember being very excited as a provider that we were going to have parity between mental and physical health care.
Okay.
What has happened is that there's just ambiguities in the law, so this strives to really specify that, clean that up, and it really focuses on I don't know how familiar you are with, prior authorization and all the steps for insurance.
I'm a freshman. I'm still learning. I'm sorry.
So it depends on what care you're trying to access. Sometimes I, as a provider, have to ask for sessions before. I used to work in grad school a long time ago for an insurance company, so was on the receiving end of those calls and authorizing treatment. And so some of the things that we really want to make sure is that when the decisions are being made by the folks who are doing the insuring, that they're based on the medical necessity of the case and the person who's in front of them. What can happen is that the person who is making the decision, sometimes at the insurance company, sometimes may have experience, for example, in the mental health field, but sometimes may not. And so the ask is that, part of the ask is that when the assessment is done, and Rachel talked about this, you have mental health practitioners making assessments and saying, this is what is needed. This kiddo was in front of me. I've made this determination, through my expertise, and this is what we're requesting from the insurance companies. Right now, their experiences, and I know clients that this has happened to. We're talking about family members here too, and then that gets denied. And so part of it is asking for, okay, if the mental health expert has said, who is working with the person, this is the care that we need that's medically necessary, that then get covered. David, what else am I missing? So I just wanted to get him to answer more in case I was missing more for you.
Yeah, thank you, Representative. It's really about creating so nationally, clinicians have described what the standards of care are for mental health and addiction. And so it's making sure that those medical necessity determinations are consistent with those standards that have been set up nationally. And in many instances, groups like the American Society of Addiction Medicine, they have level of care criteria that basically say this is the level of care that's most appropriate for you based on a whole range of dimensions of your illness. It could be family support, it could be your history of addiction, and this is the most appropriate level of care that will maximize the opportunity for you to get better and recover. And so based on an assessment, like with using a tool from the American Society of Addiction Medicine, the health plans would have to make their determination consistent with those nationally recognized standards.
Gotcha. So with that, I guess the way I'm reading the bill, my concern is if we're going to this new way of addressing these medical conditions, and there's no, we're simply saying to insurers, you shall cover in X way. Is that going to raise premiums at all?
So I would want to push back a little bit on the first part that you said. These aren't new ways of addressing mental health or substance use issues. Okay. It's not like all these new treatments are being made and then that's what's being put forward. This is saying, as David was just saying, there are standards of care, that we as clinicians follow, and asking for, when you take into account what's happening for someone and make that determination as an expert in the field, that those standards of care are also followed. So it's not something, new treatments. It's not, it's not asking for, new treatments that are out there. That's not what we're talking about. We're talking about standards of care.
So you don't see an effect on premiums at all?
I'm not, I can't speak to that. I'm a mental health care person.
Okay.
I can't.
Okay.
Yeah,
Can we two representatives take that one offline?
Okay,
Thank you.
Sure.
Because we have two more questions
sure.
before we move
Yeah,
on.
no
Thank
problem.
you. Okay, well, we have three more. Representative Vice Chair Harris.
Thank you, Madam Chair. And thank you for sharing your stories with us. It's it's always more insightful when we hear actual cases, and so I appreciate you being here. And this question is probably more for you, Representative, or actually any of you, but it may gear towards more your expertise. So, mental health parity legislation. So currently, I believe there's Senate Bill 27 going on right now. Are you aware of what are the differences between your bill and the Senate bill?
So I've been focusing on this bill, and I'm aware that Chair Anthony is working on that as well. And so we'll look into that and the differences. I've been focusing on ours, but yes, well aware.
Okay, thank you.
Yeah.
My biggest concern is that I think Michigan already complies with some federal mental health parities, and I'm curious which bill is going to
Sure.
address
Yeah.
things the best.
Yeah.
So thank you.
Yeah, absolutely. Yeah.
Thank you. Representative Breen.
Thank you, Madam Chair. As I was coming in, I was trying to think of a good question regarding this legislation. What I couldn't get out of my mind is the struggles that my own family has faced. And some of you know this. It's been hard. My kids are in elementary school. COVID made it even harder. And my son has a fairly normal diagnosis. He's got some behavioral issues and anxiety. And finding somebody to see him has been next to impossible. And I appreciate the conversations I've had with some of our other partners like Blue Cross Blue Shield. We've had very candid conversations. By the time I even found somebody that could see my son, it cost us well over $200 a visit.
Mm-hmm.
And I understand we have a lack of providers. And compared to some of the stories we've heard today, I'm grateful for the problems that I have. But what it boils down to is my question is this: how is this bill going to help my kid? Because if I am struggling, I can only imagine how much other people are struggling.
Thank you, Representative. I think the way that this HB 4707 will help is that it would require that plans have in-network services. And if those in-network services are not available, then the plan would have to help the family find out-of-network services and make sure that families are not on the hook for additional costs because the plan does not have the services that the family needs. So I think that is a primary way that that this would address address problems like the ones you're having. There's also there is a provider shortage. I think some of that is driven by, unfortunately, historically low reimbursement rates for mental health, and substance use and addiction clinicians, which mean that people haven't entered this field as often as we would like. So, there's certainly we are in the middle of a mental health and addiction crisis in Michigan and across the country. There's certainly many different aspects of this crisis, but certainly getting health insurance right and making sure that that health plans are living up to the promise of the policy that they're delivering is really critical, because if that's not in place, then the rest of the system is carrying all the weight, and the rest of the system can't carry all the weight to address this crisis. And taxpayers honestly shouldn't be expected to pay for what health insurance really should be paying for, because these illnesses, when they're untreated, they actually drive huge physical health care costs as well. Which I think is one thing that's unappreciated, and it's why we don't actually see increases in costs or premiums when mental health is covered appropriately. These other physical health care costs, really decrease, and you also don't have the emergency department visits, the hospitalizations that almost inevitably result when people don't get the services that they need.
Thank you. I appreciate that.
Thank you. And our final questions coming from Representative Bruck.
Thank you, Chair. I have two questions. First, I do want to say thank you for your bravery for Rachel, and your name is visitor to me, so
Janine.
Janine, thank you for your bravery in coming and testifying. That's very, very admirable. The common theme I hear is a lack of providers. So my first question has to do with that. Will this bill help provide the funding or provide the the necessity for those providers. And then my second question can just be answered in yes or no. Will your bill, if it had been instituted earlier, have helped in their situation directly? You know, and if you want to expound on that, you can, but just a yes or no on that. Like,
Sure.
would have had avoided what they went through.
Sure. Do you want Rachel and Janine to answer that first? I don't want to speak. I mean, I have my thoughts on it, but I defer to them.
Well, you
Yeah.
wrote the bill, so I guess that's what I'm asking, if it would have addressed your needs specifically.
Yes, I think it would have. For one thing, we would have had an in-network, they would have helped us to have an in-network provider or if we couldn't find an in-network provider, helping us to find an out-of-network provider, processing the claims. A big piece of the puzzle was the guidelines, the criteria that they used to determine medical necessity were unclear. And they were not available to us. And so when it was time for us to appeal, it was impossible for us to give them the information that they needed to establish that my son met it. So, you know, the clarification piece and the consistency piece is really key in why this bill is important to me.
And that's in the bill. I mean, that would specifically address that
That's it,
issue.
yeah.
Okay, thank you.
Yeah.
It would have helped for the same reasons that Rachel said with the in-network and out-of-network providers. Yes.
I can speak to your first question. So our mental health crisis here in our state is to me, I look at it as a big puzzle. There's not going to be one bill that's going to fix everything and address all the needs that we have, and just because the spectrum is so large. And so I see this as a significant and integral piece of that puzzle to be able to kind of, like weave in the other things that we're doing in several different committees. When thinking about the workforce issues, I mean, there are things. I mean, I started last session, advocating for help to get more social workers into our system, and staying here in Michigan. And helping us with this. We're working on getting more school counselors, again, to be able to help our young people. We are working on work on the community level as well, not just in with providers themselves, but with paraprofessionals. The other issue that I think that it's not in this bill, but I was thinking about, David, when you were talking, was I, as a provider, go through what's called paneling, so I have to get accepted to be on a panel, and I have done that. But I also knew that there are two that I applied to years and years ago, and I'm in Ann Arbor, and so I had a lot of students, and I had a specialty at that point in eating disorders, and I had a long list of clients who were waiting for me to get that authorization that I was on that panel. Well, and because there was no other providers who could do that work, or they were full in our area. And I first got denied to be part of the panel. And then I asked again. I went back and appealed that process, and then was granted and allowed to be on that panel. So I could then see all those people and get them the help. And they're young people, right? They're in college and grad school, so they can't afford to pay out-of-pocket rates. That's just not something that they can afford. So I think, again, when we think about these issues, I think there are multiple things we can think about in moving the needle, but it isn't as simple as just one bill.
Well, Representative Brayback, panel, David, Janine, Rachel. See, I remembered all your names, okay? And I didn't even have to look at the paper. Thank you so very much for your testimony. We do have Gabe Bassel from Blue Cross Blue Shield who wants to speak to your bill.
Thank you, Madam Chair.
Thank you so much.
Thank you, Chair Carter and members of the committee. I'm Gabe Basso, the Manager of Government Affairs for Blue Cross Blue Shield of Michigan. As the Chair noted, we are here today opposed to this bill. In its current form, we have had some good discussions with the bill sponsor and the committee chair, and we do look forward to the opportunity to work through this issue moving forward, I did want to offer, just a couple thoughts here. Certainly, my heart goes out to the families here today. Some of the stories we've heard are very upsetting and certainly things that I think we all want to correct here in this room today. I know our company does consider itself a leader in this area in trying to expand access, access for coverage, access for these services. We've launched in recent years several very big initiatives. We have the Collaborative Care Initiative, I think, which is one of our hallmark programs. It is the only designation nationally that exists today. But we designate certain primary care providers as collaborative care practices, and that means that the practice has embedded a mental health provider, a behavioral health specialist, such as a licensed psychiatrist or licensed psychologist within the practice, as well as a caseworker to work with individual patients. So we currently have, I believe, 213 collaborative care practices throughout the state of Michigan. This is, as I said, considered very innovative. It to our knowledge, is the only program of its type that exists at this level nationally. So we've certainly we've had a lot of discussions with our national counterparts. People are excited about this. They want to learn more about the program, and that makes us certainly proud to be able to offer this service. We've I believe in September of last year, launched a digital health solution called referred to as Able 2, which provides immediate behavioral health counseling for all of our insured and self-funded group members. So most Blue Cross Blue Shield of Michigan and BCN members have access to this tool. And even more recently, I believe in just January or February of this year, we launched another behavioral health program called Livongo. It's service provided by Livongo. It is something that it's a program that tailors treatment to individuals specifically. It's specifically tailored to each individual. So our members will fill out a questionnaire. Somebody will reach out to them. It will include things as simple as, what is your preference? Would you prefer to be counseled by a male or a female? Would you prefer something in, what type of setting do you prefer? And the program then individually customizes and tailors the treatment plan. So we do take a lot of pride in the work that we've done in this space. As you've heard here today, it is a very challenging area. I believe somebody else has already touched on this, but the recurring theme, if I were to play back the tape from today's hearing, that I'm hearing is provider shortage. There were no providers available. There were no beds. There were no beds. There were no beds here in Michigan. And I don't necessarily disagree with many of those comments. Unfortunately, as an insurer, we don't have any direct control over any of these things. We can't create more beds. There's, I think what the bill does here today, and you've heard this alluded to a little bit, is it would require us to pay pretty much any facility that falls into any category along this continuum of care, which is referenced in the bill. And in some cases, this will include unlicensed facilities staffed by unlicensed individuals. These would be halfway houses or sober houses, which they're often referred to. And I don't mean to sit here today and imply that they don't provide a valuable service, but I just wanted to throw out a few highlights of some of the aspects of the bill that we find probably the most concerning. Also prohibiting health plans from making any distinction between in-network and out-of-network care. Again, I think listening to the real-life stories that we've heard here today make very clear what the intent is, but the way the bill is currently written could allow somebody to decide that I would rather seek treatment at And we've seen some of these facilities advertised. You will see them when you watch your television. I would much rather receive my treatment on the beach in Malibu. You know, and I'm not trying to be glib here. That's an actual fact. Under this bill, we would have to pay for these. Cost hundreds of thousands of dollars for a 28-day stay. By the way, so we'd be forced to pay full freight for that. So just a couple of the items I think that are jumping out at us as most concerning. But as I said, we've had some great conversations with the chair and with the bill sponsor, and we do look forward to doing our best to try to work through some of these issues. So with that, if anybody has any questions.
And we do have a question. Representative Scott.
Yes.
Hi, thank you for your testimony, and thank you so much for that moving story. I want to know, okay, so you didn't have beds potentially, right, to be able to accommodate the customer, but why the inconvenience and delay with getting back to her? What about the lack of service with that?
Yeah, I wish I could comment on that, but without knowing anything about the particulars of her individual case, I think I would be remiss.
But you can find out, though, right?
Absolutely,
And get back
I'd be
to me
happy
about
to.
that.
I will work through Representative Brayback to get the individual's information, and then we'll circle back with you. Does that sound okay?
That would be good.
Okay,
Yes, I would
super.
appreciate that.
Representative Fitzgerald.
Thank you, Chair. I just have your Malibu example is catchy, so I want to ask about this a little bit. So my point would be, is there a way to tailor this so that that there might be some boundaries by which that could be amended to make this more effective by your standard, to say whether it be a distance or based on care needs, that there are more localized options to that? Because I look at this too, and it sounds like from some of these examples is that expediency of the claims handling or other issues are a challenge as well, which I know very well, coming from in industry, but not the health side, that is challenging. But I'm just curious to know if there are some tailored options that could amend this to make this more functional, I guess, within the Blue Cross Blue Shield system.
That's a great question. Thank you, Representative. And that's something we will certainly be seeking to do when we work with Representative Brayback on this issue moving forward. So I certainly, when I come here before you and cite all of our concerns, please know that when I do that, we're also simultaneously working to try to figure out ways to address some of those. So we will definitely be looking at that. Thank you.
Okay, seeing no more questions, we have a lot of cards to read in, okay? We have.
Thank you.
You are so welcome, Gabe. You want to sit there for a while? We have Alan Bolter, Community Mental Health Association of Michigan, not wishing to speak and supports the bill. We have Kelly Doyle, the HIV/AIDS Alliance of Michigan, not wishing to speak and supports the bill. We have Jennifer Midland Self, not wishing to speak, supports the bill. We have Michelle Massey, Advocates for Mental Health of Michigan, not wishing to speak and supports the bill. We have Antonio David Garcia, Affirmative Community Center, not wishing to speak, supports the bill. Shayna Lee, a parent, not wishing to speak, supports the bill. We have Rosalie Austin, Advocates for Mental Health of Michigan, not wishing to speak and supports the bill. We have Maria Pena, a parent, not wishing to speak and supports the bill. We have Marianne Huff, Mental Health Association in Michigan, not wishing to speak and supports the bill. We have Aaron Knott, Equality Michigan, not wishing to speak and supports the bill. We have Christine Shearer, Michigan Association of Health Plans, not wishing to speak, opposes the bill as written and willing to work with the sponsor. So, what I need now, I need a motion to report House Bill 4707 with recommendation. Rep. Young moves to report the bill. Mr. Clerk, would you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone, Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
No.
Markkinen, Bazat, Aragona,
No.
Bruck,
No as written.
Nyer,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 4 nays, 1 pass.
Thank you. House Bill 4707 is reported with recommendation. Okay, and these are yours. We have lots of these cards too out here, but it's too many to read. Okay. Next on our agenda, and moving quite quickly from here on in, okay, it is Senate Bill 326, for which we heard testimony on June 8th. Okay, we need, I guess we go right into this. Okay, it said read the card before the votes. Do we, no cards? Okay. We need a motion to report Senate Bill 326 with recommendation. Rep. Grant moves to report. Mr. Clerk, would you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone, Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young, Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Yes.
Markkinen, Bazat, Aragona,
Yes.
Bruck,
Yes.
Nyer,
Yes.
Smith.
Yes.
Madam Chair, you have 14 yeas, 0 nays, 0 pass.
Senate Bill 326 is reported with recommendation. Next on the agenda, we have the ACA package. Before we take up this package, I wanted to make a point of saying how much I appreciate the way in which this package was moved. First and foremost, I want this committee to be collaborative. I firmly believe that if we disagree on something, there's a good reason. There is something in your life experience that's different from mine. With that, exactly how negotiations on the ACA package have gone. Substitutes for bills we will hear were written with stakeholders and our Department of Insurance and Financial Service colleagues. Again, I want to applaud the way these bills have been handled by all parties. With that, let's look at the first package of bills. House Bill 4619, for which we will hear testimony on June 8th. Okay, wait. So I'm going to take and read in the cards for 4619. Okay, team, where we at? Okay. It says read in the cards before the vote. Okay. So we have Adrienne Zaya, Young Women's Christian Association of Kalamazoo, not wishing to speak and supports the bill. We have Aaron Knott, Equality Michigan, not wishing to speak and supports the bill. These are all 4619. The one I just read was the entire package. And then the final bill is Dyke Vancouvering, Insurance Alliance of Michigan, not wishing to speak and supports the bill as introduced. And then we have one more. We have Mike Van Beck, Mackinac City Center of Public Policy, not wishing to speak and opposes the bill. So now we will move down to 4619. Next we have House Bill, wait a minute. Hold on. Give us a second here. And she already moved it, right?
No, you move it now.
Yeah. Representative Grant moves to report the bill. Mr. Clerk, can you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Pass.
Markkinen, Bazat, Aragona,
Pass.
Bruck,
Pass.
Nyer,
Pass.
Smith.
Pass.
Madam Chair, you have 10 yeas, 0 nays, 5 passes.
Thank you. House Bill 4619 is reported with recommendations. Next, we have House Bill 4620. Before everyone is substitute H1. Here to explain the substitute is Representative Rogers. Representative Rogers?
Thank you, Madam Chair. I will be brief. House Bill 4620 has an H1 substitute before you to better align it with the Federal Affordable Care Act. Just calling attention to a couple tweaks on page 1, line 6. The federal definition of grandfathered healthcare plan is included in those exempted. There is also the inclusion of retiree-only standalone dental and standalone vision plans to be exempt from the pre-existing conditions provisions. This is on page 2, lines 9 through 11. These changes were derived from suggestions of stakeholders and with the agreement of the Department of Insurance and Financial Services, and I thank everyone for their input, and Madam Chair.
Thank you so much. We need a motion to adopt the H1 substitute. Oh, Representative Scott moves to adopt the substitute. Mr. Clerk, will you please call the roll?
Representatives Carter?
Yes.
McFall?
Yes.
Coleman?
Yes.
Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant? Harris?
Yes.
Markkinen? Bazat? Aragona?
Yes.
Brock?
Yes.
Nyer?
Yes.
Smith?
Yes.
Madam Chair, you have 15 yeas, 0 nays, 0 pass.
Okay, we are here. Thank you very much. The substitute is adopted. We need a motion to report House Bill 4620 as substitute H1 with recommendation. Representative Fitzgerald shaking his head. Mr. Clerk, could you please call the roll?
Representatives Carter?
Yes.
McFall?
Yes.
Coleman?
Yes.
Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Pass.
Markkinen? Bazat? Aragona?
Pass.
Brock?
Pass.
Nyer?
Pass.
Smith? Madam Chair, you have 10 yeas, 0 nays, 5 passes.
Thank you. House Bill 4620 is reported with recommendations as substitute H1. Next, we have House Bill 4621. Before everyone is substitute H1. Here to explain the substitute is Representative Fitzgerald.
Thank you very much, Madam Chair. With regards to 4621, we had two changes in order to take into consideration stakeholder engagement, including that from DIFS and some others. What it did is it struck two sections that were essentially duplicated in other areas of statute and thus not necessary in this bill. And so in order to clean up those language, those two sections were stricken from the bill, and this substitute reflects that change.
Okay, thank you very much. Let's see where we're at. We need a motion to adopt the substitute H1 for House Bill 4621. Vice Chair McFall moves. Mr. Clerk, can you please call the roll?
Representatives Carter?
Yes.
McFall?
Yes.
Coleman?
Yes.
Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Yes.
Markkinen? Bazat? Aragona?
Yes.
Brock?
Yay.
Nyer?
Yes.
Smith?
Yes.
Madam Chair, you have 15 yeas, 0 nays, 0 pass.
Thank you. The substitute is adopted. Now we need a motion to report House Bill 4621 as substitute H1 with recommendation. Rep. Rogers moves to report Rep. Rogers moved to report. Mr. Clerk, can you please call the roll?
Representatives Carter?
Yes.
McFall?
Yes.
Coleman?
Yes.
Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Pass.
Markkinen? Bazat? Aragona?
Pass.
Brock?
Pass.
Nyer?
Pass.
Smith? Madam Chair, you have 10 yeas, 0 nays, 5 passes.
Thank you. House Bill 4621 is reported with recommendation as substitute H1. Next, we have House Bill 4622. Before everyone is substitute H1. Here to explain the substitute once again is Representative Fitzgerald.
Thank you, Madam Chair. Yes, This is Representative Miller's bill. There were two sections actually added, a new subsection 2 and a new subsection 3, taken into consideration with, again, stakeholder comment, clarifying the prohibition on annual and lifetime limits only applies to essential health benefits, and then also an exemption for grandfathered and short-term limited duration plans. And I thank the stakeholders for their engagement on clarifying this bill.
Thank you. Are there any questions? Hearing none, we need a motion to adopt the H1 for House Bill 4622. Rep. Coleman moves to adopt the substitute. Mr. Clerk, would you please call the roll?
Representatives Carter?
Yes.
McFall? Yes. Coleman?
Yes.
Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Yes.
Markkinen? Bazat? Aragona?
Yes.
Brock?
Yay.
Nyer?
Yes.
Smith?
Yes.
Madam Chair, you have 15 yeas, 0 nays, 0 pass.
Thank you. The substitute is adopted. Now we need a motion to report House Bill 4622 as substitute H1 with recommendations. Rep. Young. She moves to report it. Please call the roll.
Representatives Carter?
Yes.
McFall?
Yes.
Coleman? Yes. Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Pass.
Markkinen? Bazat? Aragona?
Pass.
Brock?
Pass.
Nyer?
Pass.
Smith?
Pass.
Madam Chair, you have 10 yeas, 0 nays, 5 passes.
Thank you. House Bill 4622 is reported with recommendation as H1. Now we have House Bill 4623. Before everyone is substitute H1. Here to explain the substitute is Representative Colazar.
Thank you, Madam Chair. I only need about 45 minutes tops. So.
You see how the audience is. Anyway.
Okay, so first of all, thank you to all stakeholders for feedback, diffs, as well as questions that were on this committee. Really appreciate all of the dialogue we had. All revisions were made to provide more specifics and align this bill with federal law based on diffs and stakeholder feedback. This clarifies that the director of diffs can only identify an item as a preventative service should it meet the requirement of being based on recommendations from the U.S. Preventative and Wellness Services Task Force and other federal criteria. This aligns with the original intent and addresses the concerns with the delegation issue as presented in the Braidwood decision. It clarifies the bill only applies to an individual or small group market plans. It clarifies that these requirements do not apply to out-of-network providers and can impose cost sharing. If no in-network provider is available, then the insurer must cover the cost as a non-collect cost sharing. It specifies that this bill does not apply to short-term or one-time limited duration policies. It adds a provision with an exclusion for reasonable medical management techniques and clarifies that changes to preventative services requirements take effect for the plan year immediately following the calendar year in which they are newly recommended. That covers all of the feedback.
Okay, thank you very much. We need a motion to find wherever this is on the sheet. I found it. It's been a long day. We need a motion to adopt the substitute H1 for House Bill 4623. And I see, okay. Oh, I think that's Rep. Breen. Okay, Rep. Breen moves to adopt the substitute. Mr. Clerk, please call the roll.
Representatives Carter?
Yes.
McFall?
Yes.
Coleman?
Yes.
Stone?
Yes.
Breen?
Aye.
Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Yes.
Markkinen? Bazat? Aragona?
Yes.
Brock? Nyer?
Yes.
Smith?
Yes.
Madam Chair, you have 15 yeas, 0 nays, 0 passes.
Thank you. The substitute is adopted. Now we need a motion to report House Bill 4623 as substitute H1 with recommendation. Rep. Scott, I see you going like this. Okay. Okay, Rep. Scott moves Okay, Mr. Clerk, can you please call the roll?
Representatives Carter.
Yes.
McFall.
Yes.
Coleman.
Yes.
Stone.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Harris.
Pass.
Markkinen. Bazat. Aragona.
Pass.
Brock.
Pass.
Nyer.
Pass.
Smith.
Pass.
Madam Chair, you have 10 yeas, 0 nays, 5 passes.
Thank you. House Bill 4623 is reported with recommendation as substitute H1. So now, how do we do this? This is new.
You'll just say Representative Stone.
Okay.
Yeah.
What do we say?
If you can still explain.
Yeah. So you'll still have Representative Stone moves to reconsider the vote. You'll still read that because she wasn't here. And then I'll take the roll
Okay, this is a new thing we're doing here, but we'll get it. Representative Stone moves to reconsider the vote by which House Bill 4707 was reported. Will the clerk please call the roll?
Representatives Carter.
Yes.
McFall.
Yes.
Coleman.
Yes.
Stone.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Harris.
Yes.
Markkinen. Bazat. Aragona.
No.
Brock.
Yes.
Nyer.
Yes.
And Smith.
Yes.
Madam Chair, you have 14 yeas, 1 nay, 0 passes.
Thank you. The vote is reconsidered. The question is on the motion to report House Bill 4707. Will the clerk please call the roll on the motion to report with recommendation? Didn't say anybody do a motion.
Yeah, you gotta do a motion. So ask for.
Okay, wait.
No, it's you don't have to do a motion. No, call the motion to report. Motion to report and get a motion. No, she's correct. Oh, okay. Okay. Representatives Carter.
Yes.
McFall.
Yes.
Coleman.
Yes.
Stone.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Harris.
No.
Markkinen. Bazat. Aragona.
No.
Brock.
Pass.
Nyer.
Pass.
Smith.
No.
Madam Chair, you have 10 yeas, 2 nays, 3 passes.
Thank you. House Bill 4707 is reported with recommendation. Representative Stone moves to reconsider the vote for Senate Bill 326 was reported. Will the clerk please call the roll?
Representatives Carter.
Yes.
McFall.
Yes.
Coleman.
Yes.
Stone.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Harris.
Yes.
Markkinen. Bazat. Aragona.
Yes.
Brock.
Yay.
Nyer.
Yes.
Smith.
Yes.
Madam Chair, you have 15 yeas, 0 nays, 0 passes.
Thank you. The vote is reconsidered. The question is on the motion to report Senate Bill 326. Will the clerk please call the roll on the motion to report with recommendation?
Representatives Carter.
Yes.
McFall.
Yes.
Coleman.
Yes.
Stone.
Yes.
Breen.
Aye.
Rogers.
Yes.
Scott.
Yes.
Young.
Yes.
Fitzgerald.
Yes.
Grant.
Yes.
Harris.
Yes.
Markkinen. Bazat. Aragona.
Yes.
Brock.
Yay.
Nyer.
Yes.
Smith.
Yes.
Madam Chair, you have 15 yeas, 0 nays, 0 pass.
Thank you. Senate Bill 326 is reported with recommendation. Okay, before we close out this meeting, I want to personally thank everybody who went through this long day to get this very important work done. You know, it just shows we're here about the business of the people. So from the chair to everybody on the committee, thank you. Thank you very much. Okay, Representative Harris, Vice Chair Harris, Minority Vice Chair, moves to excuse Representative Bazat from today's meeting and also Representative Markkinen. Hearing no objections, they are excused. Guess what, everyone? Seeing no further business, we're going to stay here for another hour and sing something. No, we are adjourned.